Welcome to the Inspired Hygiene podcast. I'm your host, Rachel Wall. I'm an RDH and founder of Inspired Hygiene. For over 20 years, we've had the unique opportunity to see what really happens inside thousands of dental hygiene ops and what it takes to create transformational change that impacts the lives of patients, practice owners, and teams. Each season, we'll focus on one powerful topic, breaking it down with practical strategies, real stories, and tools you can use right away. Let's get into it. Hello, and welcome back to the Inspired Hygiene podcast. Okay, in season 5, we're in season 5 right now. And in season 5, we are going through all of the elements of the Inspired Hygiene system. And these are really elements that we have seen over the last 20 years that really are pieces of the success that our clients achieve when they work with Inspired Hygiene, but even more importantly, when they choose to empower their team, when practice owners choose to empower their team, and team members choose to step into that, right? Into that role of diagnostic partner, to be empowered to make decisions based on the clinical philosophy of the practice. And that is really exciting to see. And so we're really digging in now into that element of the empowered team. And so I'm excited because I asked Connie Simmons to join us. Connie, thank you for being here.
Absolutely. Thanks for having me, Rachel.
Absolutely. So glad that you could do this with me. So Connie is one of our lead coaches at Inspired Hygiene. And beyond that, Connie has just had a very long and you've had a really varied career, Connie, with regards to like the type of clinical work that you did, where you practiced, things that you've done outside of clinical dentistry. And I'm just really proud to have you as part of Inspired Hygiene because of what you bring to the table. And recently you worked with a team that really was kind of stuck. And what you recognized that there was a huge opportunity for the doctors to really lead the team to become empowered. And so I'm really excited to kind of hear from you what that looks like. So in your own words, what does an empowered team look like and how has that shown up kind of over the course of your career?
Right. So for me, when I go back really to the definition of empowerment, right, it has to do with having that confidence and clarity to make those important decisions and to kind of determine your own path, right, to
Mm.
control your circumstances. And that's exactly what we're talking about when we're talking about the best empowered hygiene team that we can achieve.
Yeah. And so I know I've felt empowered, right, in my career in the past. And that was one of the things that I loved the most is when I had worked with a doctor and, she had really educated me. I remember one of the first female doctor I ever worked with, she would sit down and draw pictures of things, like explaining, okay, here's the deal. Here's where this decay is. And if I go in and I remove that decay, this whole piece of the tooth is going to be gone, and so that's why I'm recommending a crown. So, she took the time to really explain to me her clinical thinking so that I could then put those pieces together in my mind with the patients before she ever walked in to do the exam, and I
Yeah.
could begin to have those conversations. Now, I mean, I know there's a fine line between, team diagnosing versus doctor diagnosing, and, we could get into that, but that was really and that's what I see with most of our clients, right? They want that. They want their team to be able to be an extension of them. So, how has that shown up in your career, and how have you seen that with clients that you've coached as well, with teams you've coached?
Yeah, absolutely. So, like you, um, so first of all, talking about my career, right? Almost 40 years of clinical practice, which I'm uh, super happy to have been able to practice as long as I have. Um, my first 2 years out of hygiene school, I had the opportunity to work for a dentist who was on the Ohio Dental Board.
Mm,
And he sat down with me just like you're describing. At the end of every week, he would take the time to say, "Okay, I'm going to develop you into my eyes when I'm not available, right? I
Mhm.
want to have 2 sets of eyes. So we went through every case, we went through every treatment plan, and he really taught me to be the hygienist that I ended up being, right? And that to have the ability to talk with our teams, and to coach our teams into this empowerment. It's one of my favorite things to coach on actually when I'm with teams. In terms of clients, like you discussed, I had a client who, well, I've had 2 great experiences. One was, the dentist said, "Well, I've never really told them to do that." I
Mm,
I it never even came to my mind that I just thought I was the diagnostician. She said, "So
mhm,
don't blame them, right? Um, but let's move forward and let's figure out
mm,
how to do this together." And then this team ended up being like 2 years later, they they are so on it, and she's like, "Connie, you don't know what you have done." Right?
yeah.
She said, All of that, I don't have to take the time because my team is so calibrated with me. They know exactly what I'm looking for, and is all I need to do is come in and say, "Amen. I gotta get back to my team," right? And that's the best feeling. That's what we want to accomplish. Um, but then on the other hand, so I've worked in a lot of offices. I've been licensed in 9 different states, so I've had a
Wow.
lot of a lot of opportunities for good and bad. And I worked as a guest hygienist one day in an office where I walked in and he said, "Just remember your role. You're the tooth cleaner, and
Mm.
you do your thing and let me do mine."
Let's take a short break to learn a bit more about Inspired Hygiene. Hi, I'm Rachel Wall, founder and CEO of Inspired Hygiene. Thanks for taking a quick moment during the episode to hear about our customized coaching program, Elevate. For over 20 years, we've delivered consistent, proven results for practices across the U.S. with clients in 45 states. Our clients see an average 6x return on their coaching investment through expanded hygiene services. Elevate starts with a roadmap of your hygiene growth opportunities and access to our Perio Protocol online bootcamp so your team is aligned and ready. Then an experienced Inspired Hygiene coach comes on site to work side by side with your hygienist in a supportive, empowering way, strengthening diagnostics and communication and developing consistent, modern standards of care. A core outcome? We help hygienists become true diagnostic partners, elevating their role as healthcare professionals through life-saving screenings, restorative co-diagnosis, and exam flow, and creating a more unified patient message. The result is better case acceptance and improved clinical outcomes because patients receive clear, consistent recommendations and clinical care across the entire hygiene team. If you're ready to elevate your hygiene services, systems, and profitability, click the link in the show notes or head on over to inspiredhygiene.com and book a discovery meeting today.
And I felt really bad not only for him because he didn't know really what that relationship could look like, but I looked at the other hygienist and I start talking to them at lunchtime about this high turnover rate and
Mhm.
how they're so dissatisfied with their role, and um, it made sense, right? And talking to him at the end of the day, I said, do you want something different? And he said, "No, I don't. I'm good." Okay. So that was the way they chose to practice. And he was going to continue to lose hygiene team members. And
Mhm.
I never wanted to go back there again. And I didn't.
Yeah. Yeah. So, okay, so let's talk about that because I think that and we'll get to kind of what dentists can do to support those team members and not just hygienists, right? This really is empowering your entire
Whole
team to
team.
be an
Yeah.
extension, right, of you because the dentist can't be in every place in the practice at once. So let's talk a little bit about what are the benefits. You know, we and you and I have gone back and forth on this many times in a lot of different topics on what is the win for the patient, for the team, and for the practice. So, when we're talking about developing team members into those that are empowered and that are engaged and involved and are honestly one step ahead of the dentist, right? And helping kind of be be those, the eyes, the ears, the communication extension of that dentist. Like, what's in that for a hygienist? What's the benefit of that for a hygienist if they really take that on and do the work, honestly, to get confident in being a diagnostic partner? What's the win for them?
So for me, and for most of my teams that I coach, it's career longevity, right?
Mhm.
I did not experience burnout because I felt like a respected co-diagnostician, right? When we
Yep.
talk to our teams about being that mid-level care practitioner, right? And that's what we equate our role as a hygienist. To achieve that and know that your doctor is gonna support what you say and to have the confidence and the education behind that, because this is not something that is just given. Like, you don't walk
Right.
in and the dentist says, "Okay, I'm gonna give you empowerment today," right? It it takes a lot of work. We have to
Yeah.
calibrate, we have to have someone willing to sit down with us and explain their treatment philosophies and give those examples. We encourage our teams, you need to sit down with your hygiene team, pull up some intraoral photos, pull up radiographs, and say, "This is what I would do in this case, and this is
Mhm.
why." And
Mhm.
then be curious as to why don't you feel confident about talking to the patient about that? Or how
Mhm.
else can I give you that verbiage to really show clarity to the patient that,
Mhm.
hey, this is exactly, I've seen cases like this, right? And it's about, right, so much of what we talk about is about the verbiage.
Yeah.
And when I can say to a patient, right, we have many teams who say, "I'm not allowed to diagnose as a hygienist," right? So we're asking you to take that. Remember that our team is only going to go as far as we lead them down
Yeah.
that road.
Yeah.
So when we can provide the training to them, they can ask questions and get curious about different treatment plan scenarios. But when I can say, and our teams can say to our patients, in cases just like this, Mrs. Jones, I've seen Dr. Smith move forward with doing a full coverage crown. Have you
Mhm.
heard of what a full coverage crown or a cap is? Right? And if the patient's like, "Oh yeah, I got like 5 of them, I'm good."
Yeah.
Right? Do you have any questions for me? Nope. Okay. Well, then we're going to make sure Dr. Smith, when he comes in, takes a look and puts extra eyes on this area that I'm really concerned with today. So it's that role of having that empowerment and having
Mhm.
that ability and believing in myself that really
Mhm.
led to such a long career. And that's what we find in our hygiene teams
Mhm.
that are the most empowered.
Yeah, I felt that too, Connie. Is it's you almost feel just that your role is elevated when the doctor trusts you to have those conversations. And the other thing that it does is it actually gives me another way to use my brain. And I like that, and actually
Yeah.
that to me, reduces burnout. It's when we're doing the same thing over and over
Yeah.
again, and it just becomes so repetitive, or we're doing the same thing over and over again, and we're seeing patients not get any better, and we're like, "What am I even doing this for?" Or, there's lots of other components to that, but for me as well, I felt the same way. I felt very respected, I felt like a colleague. And I felt like I was having an active part in that patient's oral health and their overall health. And that was a huge win for me. I would say the other thing that I've observed for myself and also as a coach is that when the doctor knows that the hygienist is teeing up those conversations, when the intro photos have been taken, when they know they're not going to have to walk in and start those conversations from scratch, they're a lot more likely to step away from a procedure to come and do a hygiene exam very quickly. So
Absolutely.
that is also a win for the hygienist, right? And they're also going to talk a lot less when they're in that hygiene exam when we can clearly communicate what we've already communicated to the patient. So, Connie, what are some do's and don'ts for dentists who really want to build that empowered team?
Yeah, good. So I can talk about a few of them that really come to forefront in my mind. The first is being willing to put the time and dedicate the training for your hygiene team to get them calibrated. This is a lot easier if you are a smaller team, maybe one dentist and a few hygienists. It is a little more challenging when you have, I've worked in offices that we've had 4 or 5 dentists, right, and 10 hygienists.
Yeah.
That's a little more difficult to get everyone calibrated. Doable. I mean, I
Mhm.
knew exactly, because I knew who was coming in for the exam, what that particular dentist would recommend in each scenario. But being willing to put the time in, that's the first. And the second would be the verbiage and the rapport that you have when you're in the operatory, right? If, as a hygienist, I have done a great handoff. That's one of the biggest things that we coach on at Inspired Hygiene, is the most productive, effective handoff that we can do. And if they've listened and they've actually heard it, um, the best thing that they can do is support it, right? They
Mhm.
can receive the information, not replace the treatment
Mm.
in front of the patient. That is the biggest empowerment. If you need to have a further discussion with your hygienist after the patient leaves, that's a different scenario. The best words to hear, going back to that triple win, right, of how the patient benefits from this, is to hear, Mrs. Jones, Connie is exactly right. And I'm going to recommend that we do a full coverage crown on that tooth on your lower right. Do you have any questions for me? That's it. And
Mhm.
as a hygienist, right, if I have taken the intraoral photo and taken the radiograph and answered all of the questions, that's all that conversation really needs to be. Those are the biggest things. Don't replace.
Mhm.
Make sure that you're reinforcing in front of the patient and building that trust.
Okay, I want to reinforce what you just said because this is really, really powerful. So, number one, you said, doctor, receive what the hygienist is sharing with you, right? And that requires a really clear, strong, confident handoff from the hygienist. So hygienist,
Yes.
when doctor comes in, right, that is your time to take charge and really communicate what has been what you've talked with the patient about, what you have observed, how you have educated the patient, and doctor really listen and receive that. So if you don't have those pieces in place, Inspired Hygiene, we're happy to help you with that. That is one of the things we coach a lot, as Connie said. So receive that information, reinforce what the hygienist stated to the patient, what they've already kind of pre-planned or pre-diagnosed with the patient. Now, here's the beauty is if you have already created a complete treatment plan, all the hygienist has to do is review that treatment plan, look in the patient's mouth and confirm like, yes, that next priority of treatment is still correct, right? So that reduces a lot of I'll say, uh, fear on the hygienist part of that whole diagnosis. Doctor, if you see that patient as a new patient, you've already created kind of that framework for their ideal treatment. All the hygienist has to do is just review that and like reinforce that. So you're receiving the information, you're reinforcing, just like Connie said with that verbiage, and you're avoiding replacing it. So, Connie, what does that mean when a doctor comes in and replaces the treatment? What does that sound like?
Well, it can sound like a few things. What we often hear from teams is, okay, everything looks good. See you next time. Right. So they've not replaced it, they've just avoided it. Right. So whether it was on the treatment plan or not, I've just spent 10 minutes talking about the need for a
Yes.
bridge or an implant, and they say, okay, everything looks good, Sally. See you in 6 months. And you're just like, what? What just
Yeah.
happened? Right. So, in a way, they did replace it. They replaced it with nothing.
Nothing. Right.
Right?
Exactly.
Or
Okay.
or, "Oh, I feel good about, let's just patch it to let's just do a patchwork. Let's just do a filling, a quick filling on that," right?
Yes.
So, words that would be better choices would be, "I see exactly what Connie's talking about, and, I feel confident that, yes, a crown would be in your best,
Interest long term.
right,
Yeah.
right, in your long-term interest, but I also know that you're leaving for a vacation in 2 weeks, and we can't get you into the schedule. So in the meantime, let's just let those 2 conversations are completely different than, let's just patch it up for you,"
Yes.
right? And that's where that frustration comes in, because now you're looking like the patient can't trust you, they feel like somehow that you tried to sell them
Mhm,
treatment, right?
mhm,
Which is the exact opposite, right? We want to
mhm.
have that confidence that that doctor's going to say, you know what, you're exactly right. And how, when we talk about productivity, doctors, so what would it look like if for every hygienist they talked about and got accepted one more crown every single week? What would that
Mhm.
mean to your schedule, right? What would that mean to overall office production?
Yeah.
And we don't just talk about the numbers, but we talk about what's best for the patient, right? But we have to look at what's best for the practice, because that's that third part of that
Yes.
triple win. It has to be right for everyone. So that's where that calibration comes in. Of in instances like this, Mrs. Jones, I have seen the doctor move forward with the full coverage crown. When they come in and flip that on you, that's the least empowering thing that you can do, as a doctor, and that's worth a conversation. And hygienist, I would encourage you that if that happens consistently, you need to start that conversation of, take the go right in and ask them, why did you decide this over this, right? I
Mhm,
thought we had
mhm,
talked about in cases like this, right? Have
mhm.
those conversations. That's going to build that relationship between you and your dentist that really is going to develop you into a great co-diagnostician.
100% agree. And I think it's worth reiterating too that, this level of co-diagnosis occurs over time when dentists, you have spent the time to educate and calibrate your team with you and teach them your treatment philosophy. When do you go for what are the criteria that you see you're like, no, I'm not going to do an MOD on that. That needs to be an onload, it needs to be full coverage, right? You have spent the time to really educate and calibrate them. This is not a, "Hey, tomorrow, we've not done any of this, and they're supposed to, be empowered and know how to line up with your treatment philosophy tomorrow." Even if it's somebody who has been with you for a long time, I encourage we call these case review meetings, right? We encourage certainly, we coach all of our clients to do these. In fact, we help facilitate those with them. But I encourage everyone to set up regular case review meetings where you're looking at cases and you're really talking about why certain things were diagnosed. And it's not to question the doctor's decisions, it is to build these diagnostic partners. And so I had an exact example of this, Connie. One time, I had a patient and they had some decay that was near the cervical part of the tooth. And I had teed the patient up for a crown, a buildup, crown lengthening, the whole 9 yards. And doctor comes in and says, you know what, actually, um, I think the best long-term prognosis for that tooth is actually to remove it and do an implant. And he said it in a way that was very respectful of me, but it was
Mhm.
very different than what I had teed up and what I had educated the patient on. And he went through the process. He's like, "Here's why." And then I went to him afterwards and I said, "Hey, so it feels like to me your treatment philosophy has changed." Because normally we would recommend this. He's like, "You know what? You're right." And
Mm.
I, been watching these teeth that we've been doing this for, and when the decay is that close, to the cervical part of the tooth, it's likely gonna go into the root, and then they're gonna do this huge investment in this tooth, and a lot of times it fails.
It's going to fail, right?
So, yeah, so I just asked him, like, "Can you bring me up to speed on what's changed?" And look, we're in a dynamic profession. There's new science that's coming out all the time, right? We're also using our anecdotal experience as we're making treatment recommendations based on what we see in the human body and how patients respond. We're looking at the patient's risk factors and what do we think is going to be best for them long term. So don't expect that your doctor is going to just have a set treatment philosophy and it's never going to
No,
change. And
no.
doctors, like, be open to your team coming to you and saying, "Hey, teach me about this because I've noticed that you have a slightly different, like, recommendation on this," or, "Why did you recommend that on this patient?" And they might know something about that patient that they just didn't have an opportunity to tell you about.
Right, and I find that often, like you said, we're in, a time of many doing these long-term, huge restorative cases,
Yes,
right? And they're going for extensive training, they're flying out of state,
yes.
they're spending a big investment in this. And if they don't come back and share that with the team after that that's going to go nowhere, right? Just like
Exactly.
you explained, if you know that your provider is now going to work on doing X, Y, and Z, then you need to say, hey, remember, as a hygiene team, we need to be brought up with speed on your new treatment philosophy and how that's going to change for our patients. That's I love that.
Yes, 100%. So, to your point, docs, when to Connie's point, when you go out and you take this high level training, you've got to come back and train your team, or even better, take your team with you. And
Yeah.
that's the even more beautiful way of doing it because then you don't have to come back and train them. They've been trained by the experts and they're ready to go and they're fired up and they're excited. So taking them with you is just going to shortcut your success in incorporating whatever that new, procedure, service, or technology is.
I
Okay,
had,
so yeah,
just let me say real quick, I had
yeah,
a great example of that, Rachel. So, one of my employers in Virginia, he decided that he wanted to start working on sleep medicine within the practice, right, and doing some appliances. And instead of just saying, "Hey, I'm just going to go and learn it all and bring it back," he took all of us whole because it takes a whole office, right?
yes,
He took all 12 of us, and then we decided when we got back what was gonna be our role in that procedure, and now I could talk about it because I learned about it firsthand, right? I didn't have to get because sometimes you get some of the details left out,
sure,
but
yeah.
I saw it firsthand, right? So just to really reinforce how important it is that if it's gonna make a big difference in your practice as a whole, it's really important that your whole team gets that education firsthand. It's gonna make a huge difference in treatment plan acceptance.
And not only, Connie, did you get that training firsthand, but you developed a belief about that service. And the
Right,
belief is really honestly the engine that drives it all. Wouldn't you
exactly.
say?
Oh, absolutely. How many times do we have teams say, I don't really feel comfortable talking about that because I don't know enough about it, right? And that
Mhm,
that comes down to everything. Adjuncts. Let's say one of our teams, our dentist says, "Hey, let's talk about adding Curodont, right, to our
mhm,
team." Unless the team really believes in that and knows the research behind it and knows the why and can explain that to the patients,
mhm,
the dentist can say all they want to implement something. But unless they have the education behind and they truly believe in, same thing with
yes,
perio, right?
yes,
If they don't know how the perio is going to benefit the patient, it's going to go flat. They're
yeah.
never going to be able to have that productive conversation. So,
Yeah.
yeah, super important.
Yeah, so part of that case review meeting is not only training your hygienist and your whole entire team. Again, we recommend everyone on the team be involved in that. Dentists and assistants, you see what's inside a tooth every day. The rest of us on the team don't. So if you can show a photo of what it looks like when you take out that crusty amalgam, it's not only you're training them on your philosophy, they're developing a belief in your philosophy. They're developing a belief in when you recommend something, they're like, "Okay, I know why doctor is recommending that. It's because this is what it looks like when they take out that old amalgam." Okay, so if a hygienist wants to, show up as that diagnostic partner, right, to just streamline, those doctor exams, to feel more empowered, and to really step into that role, what are 2 things that they can do right away? What would you tell them?
Um, so I'm going to say three things.
Okay.
Have the conversation with the dentist that this is
Yes.
something I'm developing this. Let's work on this together. That's that collaboration, right?
Fantastic.
Second, right. Second thing is we can't overlook our technology, right? We have to use our intraoral camera, our scanner, whatever we're
Mhm.
using. We
Mhm.
have to take the radiographs instead of just saying it. Like, how does it sound, Rachel, if I say, hey, Rachel, you need a crown in this tooth because it has some cracks in it, right? If I can show the patient
Yeah.
in living color all of their intraoral photos and why my concerns, right? Why we're even talking about it. So you have to show it, not
Yeah.
just say it. And then you have to lead that conversation with the patient and with the doctor. Not, oh, I've written some things down here on the bracket tray I'm going to have the doctor look at. Right? No, I am very concerned with this tooth on your lower right because of all of the things we've outlined. And I'm going to make sure that Dr. Jones, when that this is forefront of their mind, I'm going to relay all of this information when they come in today.
Yeah.
So those are the biggest things for me. You have to use our technology so the patient has an education behind your why.
Yeah.
And you have to lead the conversation with the patient and with the dentist.
Yes, completely agree. And this applies to everything that we're recommending in whether it's restorative, surgical, periodontal, whatever it might be. All of this relates to that specifically. Awesome.
Yeah.
Okay, so I would encourage you all to check out the IH podcast season 1, episode 3, because Connie joined me there. We talked about hygiene schedule. And the hygiene schedule is inextricably linked right to this conversation, Connie, about empowerment and, being able to work really effectively and efficiently within the time that we have and within our schedule. So go listen to that one. So you want to hear more from Connie. And if you'd like to learn more about working with Inspired Hygiene, working with Connie specifically, even, and how we can help you really elevate and help your team step into that role of really being empowered, engaged, and being that diagnostic partner, we would love to share with you how we do that with teams, share with you, some other teams that have experienced that as well. Just reach out to us at clients@inspiredhygiene.com. And, pass along this podcast to anybody that you think might benefit from it. We would love to hear from you, other topics for the podcast. And also, if you just have a moment, leave us a quick review. We'd really appreciate that. Connie, thank you so much for being with us. I always appreciate my time with you and just your wisdom that you have to share. Thank you.
Thank you. Absolutely. Thanks for having me, Rachel. And I look forward to the next time.
Me too. All right, we'll see you all on the next episode of the Inspired Hygiene Podcast. Thank you so much for listening to this episode of the Inspired Hygiene Podcast. We hope you got a ton of value and ideas and action steps that you can implement right away. If we can help you in any way to optimize your hygiene department, head on over to inspiredhygiene.com to book a discovery meeting with us. As always, stay inspired.